Hi, I'm Tess,
Hi, I'm Sarah, and we are.
the Happy Edit Sisters. Happiness isn't just being happy, it's an embodied feeling that starts with how we approach life, our actions, and our mindset. Everyone has a range of emotions, and that's a good thing.
Join us as we dive into what it means to be happy and how we build a foundation for happiness through different lenses. Hello, Tess. How are you?
Hi, Sarah. I am doing very well. It is raining outside, but you know what? It's actually kind of nice. It's kind of like that nice, like drizzly rain that just, I don't know, it's just very comforting to me.
So, not the rain that soaks you through, like Peter Kay says.
I mean, if you were out there long enough, you might get soaked through. But no, I don't know. It's just like that really nice sort of spring rain where it's not like an absolute downpour where you walk outside and you're instantly soaking wet. But you know, it's just, I don't know, it's just very comforting. Like you kind of want to cozy up in it, like not literally in it, but in your house. But at the same time, it's not a big deal if you have to walk outside either. Like you're not like, oh, I'm gonna get wet, you know? And it's like the little drops on the plants and the flowers. I don't know. I really like this type of rain.
I'm kind of feeling very opposite today. So it was hailstoning and raining a little bit earlier, but it feels like it's a much drier day today here. And yeah, I'm ready for a bit of sunshine, if I'm honest.
Yeah, I can't complain. We've been having quite a bit of sun, so I think that's why I'm like, oh yeah, it's raining. It's a nice balance.
Definitely, definitely. Well, I'm really excited today to have a wonderful guest on the show today. So my friend and was a colleague of mine as well. So the lovely Sue Horrocks. So Sue is an experienced adult, child, and young person centered psychotherapist, systemic family practitioner, and clinical supervisor. And she's currently working with a team in Blackpool talking therapies, supporting a team of counsellors. Sue has a history and personal passion with understanding and working with neurodiversity, childhood attachment, and developmental trauma. Sue has worked in a special educational needs and disability private educational facility and in third and public sector mental health care services with people from varying ages, gender, and ability. Sue has a strong grounding in person centered theory, built on with systemic models and practice, while bringing in her non-violent resistance and cognitive behavioral informed therapeutic techniques with an ability to creatively adapt interventions to meet the needs of the people that she supports. And I know from experience that Sue is just a wonderful human being and a therapist. She's just amazing. Sue, a little bit of an introduction there.
I was going to
Tell
say,
us a bit more.
I'd just like to know, was that quite a long, is that one of the longest introductions you've ever had to read out? That's all.
No,
Goodness, goodness.
It's not, no. We
Oh,
always ask for a short intro and you know, sometimes people give us short intros, but you know, a lot of people have a lot of really interesting things about themselves, you know, and so they want to share them. So
yeah.
yeah, no, it's not the longest one.
Oh, well, I literally just copy and pasted it from my LinkedIn profile. I'm not going to lie.
so if anyone wants to know a little bit more about Sue, go to a LinkedIn
Go
profile.
to my LinkedIn. I love, absolutely love LinkedIn. I think it's really useful. Yeah, it's a great platform. So, yeah, so thank you for that intro that I copy and pasted from my profile on LinkedIn. So I don't know what more I can add to that. To be fair, I'm very settled in my new job role, working with adults, which is very different because I've been working with children and young people for, gosh, possibly the last. I've got to be careful on time because I found out the other day somebody said to me, "How long have you been a counsellor for?" And I went, "Oh, about 22 years." It's not at all. It's 12. So I've got to be really cautious when it comes to giving time of how long I've been in something. But it feels like I've been working with children and young people and families for about 20 years. So 20 years is very forgiving. About is that forgiving side of things. So yeah, and so to move over to just work specifically with adults, it's been a transition. It's not as big as I thought it would, and it's been a lot easier than I thought it would, and I absolutely love it. And yeah, really happy to be where I'm at the moment.
Sounds like it really makes you happy, kind of moving into that transition and now working mainly with adults.
Yeah, it's different in a really good way for me to where I'm at with my development practice. So yeah, loving the adults who choose to come, so they're not made to come by their parents or caregivers. So that's one of the big differences, is they're choosing to be there predominantly. Whether they're ripe and ready for therapeutic change, as we sort of label it, is a different matter, but the fact of the matter is they're choosing to be there, and they are the decider of their own next step, where some children and young people might not necessarily be. So I think that's the niceness of being with adults. Yeah,
I completely understand that. When I was an English teacher, and I taught from like really little kids to adults, and the adults in many ways were easier because they wanted to be there, and like you'd get them like to do the exercises in class. But then at the same time, sometimes the kids were easier because they were used to being in education. And so like they would show up and they'd actually do their homework, unlike the adults. But no, I definitely get that understanding of like, people are showing up for themselves because they want to be there. And when you have someone else pushing you into it, you're not always as excited. So I totally understand that.
Benefits and barriers to both, but definitely appreciate the benefits of working with adults at the minute. Yeah.
So one of the things that, I know that you've worked quite significantly within your work, both in school and in kind of therapeutic settings, working with individuals with neurodiversity or divergence. And one of the things in the podcast that we're doing at the moment is looking at the senses. And I mean, it'd be really interesting to kind of, what's your experience of working within that area?
So I guess up until literally 2 weeks ago, I thought I was quite knowledgeable in relation to some of the conditions that sit within the neurodiversity or neurodivergent umbrella. And then I attended the National Autistic Training Programme that's being rolled out by Anna Freud at the minute. And I've realised that I've got one foot firmly in the old perspective of the conditions and old understandings. And I know I've got a couple of toes already dipped in the modern, evolved new understandings around conditions that sit under the umbrella, and how important that new evolved way of thinking is and how helpful it is. So yeah, my experience predominantly started in education and working with children and young people with communication difficulties. The main primary diagnoses would be an autistic spectrum condition, with, and as we probably understand, there's usually comorbid. So I sort of look back, going on this training now, I look back at those years in education, which was about 14 or just over 14 years, and think, gosh, if only we as a cohort, if only we as a society, as a community, as culture, as however we explain it, had this understanding back then, how helpful it would have been, particularly around sensory, and how challenging it can be to accommodate a group of people who have sensory difficulties. And again, that's how sometimes in the job I'm in, working one-to-one is a lot easier to accommodate. But again, it's still having an understanding. And I don't necessarily think that sensory differences exist solely within the neurodivergent communities. However, they're certainly part of or comorbid to a condition, a likely either self-diagnosed or diagnosed condition. So yeah, and how many senses we have, how many senses there are, as opposed to traditional 7, then there's 8, then there's 10. There's research out there now that's expanding it to 20 different types of sensory sensory parts of ourselves. So again, it's interesting how that side of things evolving.
Yeah, yeah. I totally understand that. You know, it's funny how like we have kind of focused on the 5 sort of traditional senses in this season, but then when you're looking up like, oh, the senses and things about that, you're right, like there's like 20 different things. When I first started searching that, I was like, what? Like, what do you mean 20 senses? And then you guys go into like, okay, I get it, you know, because it's talking more about how your body is responding to the world around and not just sort of the stereotypical, okay, your eyes, your nose, your ears. So yeah, no, it is interesting. But so I'm also curious about what you were mentioning, that there was sort of this sort of old school rubric and the new way of looking at it. And I was wondering if you could tell us a little bit about what the differences are there.
So I guess, so now terminology, as we progress and we get a clearer understanding and more of trying to break down barriers, and language is one of the most important barriers that can get in the way. And again, it can come to self-identity, but historically, the term high functioning autistic or Asperger's, ADHD, and it'd be person with. So there's a person with autism, person with ADHD. And again, it does come down to self-diagnosis, but there's been research done with people with a diagnosis, an autistic diagnosis. And I think, I'm hoping I'm quoting correctly here, because there's so much information that's been shared so far on the course, the 2 days that I've attended so far. But predominantly people like to be referred to as the person, so an autistic person. So self-identifying as I'm an autistic person, as we would identify as I'm a white person, or I'm a black person, or I'm an able-bodied person, or a disabled person. So it's very much about that person-led language, and how we no longer consider Asperger, high functioning autism as a positive way of talking about it. It's very much I'm autistic, and it's about get to know me and understand me as a person to understand my autism. Don't categorize me on a spectrum. Don't numerize me, because I think people are diagnosed with numbers to what level of impact the autism has. So it's very much about understanding the person. So that I thought was really helpful. And again, a lot more around thought and consideration and integration and inclusion, and how much more I guess one of the areas that I found really interesting that helped me to understand is how there are, again, with neurodiversity and neurodivergent, because that's new language, it's only really started to penetrate our sort of day-to-day, well, for me anyway, over the last couple of years. And the parallel thinking gears that was shared in this training was along biodiversity. So when we think of biodiversity and everything that encompasses in respect of plants, trees, bushes, different types of plants, the variety that's involved there, and how some are grouped together, it's very much similar in respect of neurodiversity. So it doesn't necessarily, I guess it's breaking down again further barriers of understanding that not one, as we know, autism might have specific traits and characteristics, and even that's being researched and updated in how it presents in different people. So that hopefully will come out soon in respect of the diagnostic criteria. So I think there's something in relation to again understanding the person. So regardless of how a person identifies outwardly, it's about how do you identify, considering all the graces. So if we think about the graces, just because somebody looks that way, it doesn't mean they identify that way. So again, it's how a person wants to own that, and that comes down to sensory stuff as well, because what one person who may identify as neurodiverse sensory needs will certainly not necessarily be another person. So it's very much about understanding the individual that you're with.
So it really is. It reminded me of kind of, working alongside other services at times as well, where, you'll kind of, a referral will come in, or you'll put a referral to another service, and it'll be like, no, we can't work with them because they've got autism or ADHD, or we can't work with them because no, they can't possibly be presenting with depression. It's because of this. And it's like, oh, let's work with these people as individuals. Let's on their need basis.
Oh, so true. And particularly in children's services, I think that's more prevalent in children's services. It's the hot potato, any diagnosis, ADHD, ASD. It's a way of keeping, and it is, and I'm going to say it's political, but I've witnessed it. I've been a part of it, where it helps keep the waiting list down to a degree. As in, if we can put this person over to somebody else's waiting list, it's not impacting our waiting list. And there can be that type of thinking behind it, rather than the person, with the recognition that a person who is autistic can have mental health problems, can be mentally unwell. So yes, with autism, the likelihood of depression and anxiety being more prevalent, it doesn't mean that they shouldn't still access services, because the likelihood is they'll have what we see now. And I think it was, again, I've got to be careful with language here because I can't remember how it was. Let me see, because I've written it down here. I think it was autistic trauma, because of the experiences somebody who is autistic will have gone through leading up. So I think that's what they termed it, as autistic trauma. And then we've got autistic joy. So yeah, there's lots sort of going on there. But yeah, and certainly from a counselling perspective, working with somebody who would identify as neurodiverse, regardless of whatever their self-diagnosed condition may be, if they identify as neurodiverse, then it's accepting that's how they identify.
I find it really interesting, and I understand what you're saying about, the political aspect of it, and like get them off our waiting list, put them on someone else's. But I find it really interesting that just to have that one little diagnosis, then all of a sudden they can't have these other mental health needs, but they're still a person. Like, I just said that's mind-boggling to me.
Yeah, what I've discovered on the adult in the service where I am, and it's likely uncommon, or it's likely common in other adult services, is that a person can't be on the ASD pathway for assessment and the ADHD pathway for assessment at the same time. They can only be on one or the other. Now, to me, that's shocking, because I know that both conditions can exist comorbidly with each other, alongside each other. So again, it's yeah, you go on one, and then another is that you can't go on the ADHD waiting list unless you're willing to take medication. That's another expectation, is to go on the ADHD. That's within the service I'm in, is that the willingness to take medication to reduce the risk of people going on it to try and sort of unnaturally get the diagnosis to work for their benefits, or again, I'm not very good with the language around it because it's sort of new, but yeah, so there's something around expectations when you are on that pathway to get a diagnosis, to make sure that you are genuine and you're not trying to blag it, I guess.
Again, it's services, not necessarily treating people as individuals on their needs, is it? It's kind of getting people to fit into this mold of, okay, so you've got to be this way or this way, and if you're not, you've got to want to go down on this path, and if you're not willing to do that, then nope, sorry, you can't come through our door.
It'd be nice, because one of the things, the consideration in conversation was, we have, obviously, you've got neurodivergent and then you've got neurotypical, and those difference. And there's something about, if you're born neurotypical, whatever that criteria might look like, you still could identify as neurodivergent if your brain is say with depression, we know from research, again, the brain changes when somebody is depressed or has significant anxiety or goes through a particular traumatic event or a brain injury. And therefore, that person could identify as neurodivergent but then they may recover from whatever their brain shift into what they may come out of that injury or that illness, and then they go back to identifying as neurotypical. So there's something about, again, a sense of privilege with neurotypicals being able to come in and out of neurodiversity because it's so open and flexible. But a neurodiverse person, so somebody with a diagnosable condition, is that person. They are autistic. They can't change that. That's just who they are. They will forever sit under that umbrella. And I think that's a fascinating concept. And it'd be nice just to have that everybody sits under the neurodiverse umbrella. That would just be nice. That it's a bit like I think of wearing glasses, and we all have sight in some way. Some people have no sight all the way through to have sight that's just clear as a crystal, that 20/20 vision, and differences, and we all have different ways of managing that. But yeah, I think it'd just be nice if we could all just sit under one umbrella. That'd be easier, wouldn't it?
Yeah, yeah. Huh. And like and correct me if I'm wrong, someone that has been diagnosed as dyslexic is also considered to be under that neurodivergent umbrella as well, correct?
Well,
So
if they wish to, if they wish to identify as being, as we see it as a definition, then I would say I would understand them to likely sit under that umbrella if they wish to sit themselves under that umbrella. But yeah, dyslexia as a condition would sit under neurodiversity. Yeah.
Yeah. And dyspraxia as well, I think.
Anything, everything.
Yeah. And correct me if I'm wrong, Sue. So would you, in an ideal world, kind of get rid of that umbrella?
I think because of how we exist and we like to understand, having a term is useful. So we have a term for so someone who believes in gods. So there's different gods, I think, and I'm quoting Ricky Gervais here. So that's how non-religious I am when he says, like, there's 4,000 gods and I'm just one more god. I believe in one less god than you. So there's something about what we have to have a label, an umbrella for that, and which is religion. And I think people come from different cultures and different communities, and we may umbrella term it with race, and we may umbrella term. So we have umbrella terms, I think, for lots of different things to help make sense. So I think it'd be nice just for people to sort of become comfortable with the umbrella term of neurodiversity and feel comfortable to sit under it, and then self-identify how they want to, whether they self-identify as autistic or they self-identify as sensory, or they self-identify as depressed, or self-identify as euphoric, whatever they want that works for them. And again, but I do feel we sit in a world where labels can be helpful to communicate and understand.
Communicate, but also maybe hinder, depending on what it is. Yeah. Kind of going back to the senses again. You mentioned, obviously, in this world, everyone is a little bit different, right? Everyone connects to those sensory impulses differently. But how do you explore the senses within your work?
So in relation to the people that I work with, and I think this just comes from experience of the different roles that I've been in, I tend to understand, I see it as their accessibility needs, what's going to make your experience working with me as accessible and as comfortable as possible for you. So, and it can quite surprise, and this has been historical, even in past roles, I would do this. So as an example, if I meet somebody for the first time and they've not had any accessibility questions, I'll go through and say, so the room that we're in now, how do you feel about this room? Is it too bright, too dark? And they go, no, it's fine. And I go, well, let's just turn, if it's appropriate, because I do have a room that doesn't have any windows, so it could scare the life out of somebody being suddenly in darkness. But in that one, we've got a lamp. So I'll switch it between all the walls are white, bright white light. So which would be nicer for you, this light or this light? If I'm in a room that's got natural light, I'll say, do you want the lights on, lights off? And people can be quite surprised themselves how they find it more comfortable to be in the room with the lights off, where we automatically go into a room and put the light on thinking that's what the person would want. So that's one example. Others can be around, I always make sure I don't wear perfume, I don't wear any body sprays or anything like that. So I try to remain neutral in respect to smell. I don't have any drinks or food or anything in the space or the room that I'm working in, again, for smell side of things. I'm mindful of the chair that the person could be sitting in. So I've got somebody who's quite tall, who's got a physical condition, that the chair's not appropriate, that is usually set out. So I've sought out another chair and raised it to its full height. And yeah, just different things, just really, and asking them, just sort of ask it. But it's so shocking, I think could be the word, how people just don't consider it, because I think we mask and adapt to, and we please, we don't like, I think particularly, and I don't know if it's cultural worldwide or if it's, or whether it's, I guess it comes from manners. And if somebody were to come in and be quite, we'd probably think quite negatively of them, oh, very abrasive and very whichever, rather than thinking, well, here's a confident person that actually knows what they like and what they want for themselves. So I think we're very compliant in nature on the whole. And if we sit outside that compliance, we can be seen as a bit abrasive. So when I ask people what would be helpful, what would be useful, I also mention myself as a person in relation to what they see, what they hear. If you don't like, there might be something about the way I laugh or the way I smile or the way I talk that might not fit for you. And so I make sure that they're aware that they don't have to have me as their counsellor, that there is options. And I would rather them, if they're not able to tell me because it feels too uncomfortable, that they contact the admin team and ask for a different counsellor. I think that's really, really important. And sometimes we do meet people and we don't know why we don't like them. We just, oh God, I can't stand the way they chew the lip or the way they breathe or whatever, bless them, whoever that person might be. But I just think we don't. And we don't necessarily know why or what it's attached to, but it can happen. It's so there's somebody on, I'm watching Married at First Sight Australia at the minute. I'm loving it, and it's my guilty pleasure. And there's one of the grooms on there has got it. He has how do you describe it when it's a behavior? It's just
mannerism?
body movement, the way he moves his head and jaw and says that. And it reminds me of my nephew. Looks nothing like my nephew, but just what he does. And I'm like, to my partner, and go, oh my God, he reminds me of, and I'll say my nephew, yeah. And I wait till we meet him, you'll see that, what I mean. And but it's like he looks nothing like him. It's just the mannerism, that's the word I was looking for. So it's fortunate that I love my nephew, so we're all good. But if I didn't like my nephew, I'd be thinking, oh, I don't like that groom. Oh, don't like him. He could go because he reminds me of the person I don't like. So yeah.
That my husband and I, Sarah's brother, Michael, and just started rewatching Friends. And I'd completely forgotten how like you know, they portrayed Chandler being really picky, like, oh, I don't like this girl because her fingers are too long, or I don't like this girl because of how she chews her food, you know, and just exactly like that. And it's like, you know, they make a joke out of it, but really it should be a good thing that he's like, okay, I don't want to be with this person because of this thing, you know, let's move on, you know,
Yeah.
not make a big issue out of it. I think you're right. I think it's so often we're like, oh, well, you just need to conform, you just need to deal with it, you know, and depending on the situation, fine, yes. But if you know, if it's okay to make that choice and say, actually, no, that's not for me, and walk away, not make an issue out of it, just say, okay, no, and
Mm,
then change it up, then yeah, I
yeah.
think that that should become more, I don't know, allowed isn't maybe the right word, but just more
Yeah.
commonplace.
I think it's tricky because a lot of people might think back to school days and think of teachers that they didn't get on with or they didn't like. And the likelihood is that's where our senses come into play, and we hold those people in mind. So I don't know if you can ever think back to a time, a teacher who you might not have got on with for whatever reason. They may have spoken a gruff voice, but there's a chance that, or you might have had a teacher that's had bad body odor or something. But the likelihood is whatever it is, it'll tap in, and you'll take that into future relationships of when you meet new people. And this person might have a grey beard, may smell gorgeous, but got this grey beard and it's cut in a certain way, and they speak in so, and unbeknown to you, just think, oh, I just don't like him. It's just something. But it could be back to that teacher who stank a BO and would stand over you and maybe criticize your work. But as a child or young person, you don't necessarily understand what you're absorbing. So then when you take things into your adulthood, you may not necessarily understand why you're disliking something, or not getting on. It's that sort of trigger that we may not necessarily be aware, and we dismiss as well. So yeah, so when I do meet people, clients, and I do ask these questions, a lot of the time they're like, oh, I don't mind. Very, very easy, because I think we don't think about it. We just, yeah, there's a lot needs to be thought more about what we feel, think, and touch and movement and everything. Yeah.
It's
Without.
so important, isn't it, to unpick it. And as you were talking then, Sue, about like the light in the room, and I remember working with a young person who they put glasses on because the it was too bright, and if you turn the light off, the room was too dark, and it was like, no, let me go and find a lamp that we can put on, and
Mm,
it just made the atmosphere and the environment so much more comfortable
mm,
for that person. And and I'd come through to the session with my lamp to come and put the lamp on. But even having things in the room that were maybe that there was this big like pillow that was like really soft, and actually this person and the parent would be like, no, I want it this week, no, I want it this week, and I'd be like, I'll try and find something else.
I've got a client at the moment, and they're learning. I'm giving them information or offering them information about autism, because there are traits and characteristics they're presenting, but it's not something that they're aware of as a condition. And they've lived in quite a small world, is how I would possibly describe it. But I've got a room, one of the rooms that I'm in, where there's tiles that have been put up. They've been hodgepodge put in place. Just this person, when they come into that space, those tiles really distract them because they're not aligned. Now, I was the one that pointed it out to them. I sort of said, I wouldn't be surprised if that really irritates you, because I know it irritates me. But again, it was nice to help normalize for them that, these sorts of things. So even being in a room where a picture's slightly slanted, or things like, we can go, oh, this is a quirky room. Well, for some people who have sensory, particularly the sight and things not being straight or aligned, or that sort of and needing perfection, it can be a real irritant, or it can be a real distraction. And if they're trying to process something, it can take them away from that. So yeah, there's so much that we have to be aware of. So in some rooms, it's like we're great because we have nothing, the real, as we would describe, clinical. But for some people, that's a really great room to be in. But then for others, they might think, oh, it's a bit clinical in it. It makes me feel a bit uncomfortable because it might remind them of some experience they've had in a clinical setting that's left them feeling a bit uneasy. So again, it's that sensory stuff, but trying to understand it can be really helpful.
Yeah, being aware of it. I'm just thinking now, so I'm sat next to my bookshelf, and my bookshelf has literally just got all my books thrown in, like literally just chucked in. And I've often, because when people come in, I will say, like, do you want a drink or anything before? And I'll kind of allow them, go and get them a drink, and they'll obviously be in here like on their own. And quite often I'll see somebody just being like rearranging.
Was that one of the people, your brother?
Very, very possibly. I mean, he can come and rearrange the books. Sweet.
Because that is not uncommon. It's
Yes.
interesting that you mention just bringing it to people's awareness as well and normalizing it. I think it's so often we don't realize that these things are coming up, as you're saying. Like we're noticing that we're uncomfortable for some reason, but we don't know why. And within the yoga world as well, like that's something that's become quite important, is offering different variations of things. And not because, oh, maybe it's because you can't do this, but maybe this just feels better for you in your body right now. Explore it. Hey, maybe try out this way, and then maybe try it out this other way. And it's something that like I have learned to bring in a lot more into my classes and my work one-on-one with people as well, just because like people don't necessarily know, because you just get used to the flow. You get used to everyone else is doing it, so I'm going to do it that way. But then when you start moving, when you start trying these things out, as you say, you start connecting with your senses, and then you realize, actually, that's not sitting well with me. Okay, if I do it this other way, hey, this is much more comfortable. It doesn't change what I'm doing necessarily, but I feel more comfortable in my body. I feel more comfortable in the space around me. Okay, let me do it that way. And then maybe the next day it's going to be different. I mean, who knows, right? So it's about giving the people that autonomy to really explore. And I think so often because of how we are raised, because of our society, it's like, just get it done. Just do it this way and get it done and move on, and it's like, well, no, let's pause, let's explore this, let's see how it feels for us.
And the compliance that our school system, I think that's why my understanding, and I might have this wrong, but my understanding is why the British education system or the English education system is so prized, is we nurture our children into becoming compliant human beings. So when in preparation for the workplace, so there's that sense of when we have some of those young people that fight against that compliance, they're seen as naughty. It's all very negative narrative around them, as opposed to prizing them for their individualism and finding, well, what will work for them. That's not how our system works. And I think there's a big drive to have our education system looked at and overhauled, because it isn't fit for purpose at all in this evolving world. But I do think that we are nurtured into being compliant people, and anyone that sits outside of that, we have this, again, nurtured narrative of negativity, that, oh, well, you're a trouble causer. So in work, if there's a member of staff who might identify as autistic or ADHD or sensory processing difficulties, and they'd like, well, I can't work in that room for this reason. And it's like, well, behind the scenes, to the bit, it's like, okay, leave that with us. But behind the scenes, there's negative narrative because this person's causing a problem, as opposed to seeing this person has been able to vocalize their need. So being grateful that you've got somebody on the team who's able to vocalize that, because if we can help support their need and swap them and get them into a room that's more fit for purpose for their sensory issues, or not issues, for their sensory needs, and then bring somebody out and put them there, the likelihood is that member of staff's going to work more effectively, better outcomes, and more likely to stay in work and not be off, because you keep them in an environment that's unhelpful for them. It's going to cause them stress. The likelihood is they'll go off. So it sort of benefits to have a person feel able to vocalize. But I think we're in a society still where we do keep quiet. We do silence ourselves, particularly around sensory stuff, because it's still, I think, for me, it's still seen as, oh, I don't want to be, it's just sensory, isn't it? I just can't stand the noise, but I'm not going to say anything because I'll just be a troublemaker. Or I can't stand that room because the light's too bright, but I'm not saying anything. I'll just put up with it, put up and shut up. There's still that culture, I think, that we particularly in work and schools, that we exist in. It'd be interesting to know, do we at home, who's, those people that are compliant in the home, like my partner, bless his heart, we've got this set of cutting boards. So there's like one for meats, one for veg, one for fish, and one for bread. I don't blinking know, but there's 4 of them, color coded, and they all slot in their own little slot in order. So bless him, I'm hoping that he won't listen to this. So when I take them out the dishwasher, and we're very fortunate and grateful, but when I take them out the dishwasher and I shove them back in, I just shove them in. I just go in, because who cares? There's only me and him that exist in this environment. We very rarely have visitors who are going to come along and go, oh my God, those boards are all out of order and colour. So bless him. I've moved in with him 6-7 months ago, whatever it was. And I just did shove him in. And he's been really trying to do some self-exposure therapy by seeing if he can put up with it. And the other day he went, I need to ask you something. I thought it was dead serious. He went, those 4 boards, I need them to be in order. I need them to be, so you can see the picture on each one, so it's in order like that. I went, all right, okay. So I think in our home environments, we have needs as well, and to consider each other. So I was like, all right, okay. And I totally understood it. And I think probably because I've been very fortunate to have been in the job roles that I've been in and had that understanding. But for some partners to have, one, to say it to a partner, the other partner, I think of my mum with my dad, my mum would have probably gone, oh, stop being so ridiculous. Oh, for God's sake, don't be so. And she'd see it as my dad's problem, as in, if I wasn't me, it's at risk of seeing it as Harry's problem, when in fact, no, it's not. It's, yeah. So, yeah, there's many things.
Yeah.
I'm the same.
Next time I come to yours, I'm going to be like, oh, I wonder what order them boards are.
Oh no, they're in perfect order now. They're in perfect order. I'm respecting his sensory request and need. So yeah.
This was the kind of the probably horrible big sister part of me when we were kids. So our Michael, I'd say self-diagnosed autistic, more than likely. And when we were kids, so I'd go downstairs and my dad had buttered his toast and put his toast nice in like a nice order. It'd been nice and cut down the middle, and it'd be all like really neat. And I'd go over and I'd mess it all up purposefully for him. And and I might even take a little bite out of the end as well, just really to like wind him up. And I do this it's awful, really. I do it every morning. And he'd come down and he'd be rightly so frustrated with me. And he'd put the fridge magnets all like in order that he wanted them on the fridge. And I'd like maybe go and turn one upside down or move it out of the way. Oh, bless him.
So it's funny though, like he's still very much like that, but at the same time, he will go into other people's houses who he knows it bothers, and he will flip magnets around and like reorder things. So even though it bothers him, he will do it to other people. So I wouldn't feel too bad.
But this is one of the things, because it's a bit like I self-diagnosed misophonia. So particularly if I'm tired, so it's a noise thing. But if somebody's eating a packet of crisps or eating an apple or a ticking clock or a clicking pen, if I'm tired, I'm super sensitive to it. I'm sort of hypersensitive, and it raises a sense in me that I feel like I could punch, scream, shout. It really intensifies. But I can eat a packet of crisps. and I can eat an apple. So it can sometimes feel contradictory or hypocritical. Because it's like I could sit next to Harry and he could be eating crisp and going, oh my God, can you just hurry up? Well, fortunately, he's a quick eater, so it's not too bad. But I'd be like, can you empty them in a bowl so I don't have to hear the packet? Can you suck the crisp? You have to actually crunch it. But at the same time, I could eat out of a packet and crunch them. It wouldn't be a problem. Yeah.
Yeah. Yeah. Yeah. Completely understand that. Completely understand that.
So interesting.
Sue, this has been such a wonderful conversation, and we've really enjoyed, well, at least maybe I shouldn't speak for Sarah, but I have really enjoyed all of this. Like, this is just lots of new information for me. And I would love to know if you had a happy edit tool for our listeners, something that they could use to bring in to their own lives to kind of play around with, see if they could add a little bit more happiness.
So for me, it's really, really simple. And it's just 2 words. So my tool exists of 2 words, which is look up. That's all I can say is look up. So no matter where you're going, what you're doing, sitting, whatever, just raising your head up. We look down too often. We're looking down either at our phone, at our feet, as we walk along, as we drive. It's almost like a looking down thing. We don't tend to look up. And I think the more we can look up and take in what's around us, even if anyone with sight issues, it's just that raising of the head, raising up. It can make a big difference to your posture, and lifting up your posture can lift up your mood. And I do believe there's research to prove that as well. So look up. It's as simple as that.
I love that. Yeah, really, really do. So everybody can just spend a little bit of time this weekend just looking up.
Just look up. Yeah. Simple. And there's nobody that can't do it, and you can do it whenever you want.
Amazing. Well, Sue, I would like to thank you so much for joining us today.
You for inviting me. Thank you for inviting me. I hope I've not consumed too much time. I do witter sometimes.
Oh, no, honestly, it's been so lovely.
Thanks.
Lovely having this conversation. I could definitely speak to you, and we do, when we go out, we do speak for hours about these things as well. Stubborn stuff.
I know. The more I go on this course, the more I'm going to learn. The more I'm like, oh, I might go and do so. I always say I'm not doing any more qualifications. That's it, done, dusted. But this is an area that I would love to develop. It is, and I think the more I'm learning how it's evolved, and it's evolved more into how I used to think. It's like, it's certainly an area that I'd like to further look at. So watch this space.
Definitely. Well, thank you again so much for coming. Thank you, listeners, for joining us today. And you can catch all of Sue's information in the show notes. So go check out more about her, contact her. We will have all of that stuff there in the show notes. And as always, if you have enjoyed this episode, please let us know either on our Instagram, the.happyedit, or leave us a review in iTunes or Spotify. We'd love to hear from you. Thank you again, everyone, for being here, and we will talk to you very soon.
Bye. At the Happy Edit podcast, we're mindful that the podcast is not in replacement of therapy. If you do need further support, please do contact us on our contact details in the show notes, and we're more than happy to offer further support and guidance and direct you to places like the counselling directory or therapy directories. If you do also need further support, we would also recommend you contacting your primary healthcare provider. Thanks very much for listening, and we'll see you all soon.